Greetings, fellow Americans. Welcome to Fireside Chats, State of Our Nation. I am your host, Susanna Tanner, candidate for House of Representatives 2026 and President 2028. We are going to continue with the Universal Healthcare Service system. Universal Healthcare System. There is something to point out here, though. If an individual wants to stick with their current insurance companies, they are more than welcome to. This is an opt-in, so it's not required that you pay into that particular lockbox. Remember, though, that current insurance providers get to choose what they cover, including prescriptions, and will often leave the insured with out-of-pocket costs. I know more than a few individuals who experience this from insurance companies. In the U.H.C., the only care not covered is cosmetic surgery for purely looks. Purely looks. Speaking of surgeries, let's talk about the patient load limits. No clinic should ever have so many patients that there is a 3-month waiting period for an appointment. Most of the government clinics that currently exist grant only 15 minutes for one. Most patients wait longer than that to actually be seen by the doctor. And clinics have called and canceled appointments just as a patient is arriving for their appointment. Doctors are therefore forced to provide minimal care to the clinic patients, or they get no care at all. To compensate for some of this, especially overflow, while keeping wait times down, there is a patient load limit for each clinic, and they are established per doctor per clinic. And the U.H.C. will partner with non-U.H.C. practices, private practices basically, to help get more patients seen. And this will prevent physician burnout. To allow more patients to receive health care, additionally, the U.H.C. will partner with traveling doctors, licensed traveling doctors who attend rural areas and relocate for purposes like that. There will also be options for telehealth appointments. And this is actually becoming a more common type of healthcare, telehealth appointments. Sometimes you just need a quick follow-up or a quick question, and that doesn't require a visit to the doctor. Medical professionals, RNs, CNAs, and doctors may use staffing apps to efficiently fill vacancies in shifts across all facility types: hospitals, nursing homes, schools, home care. The app includes a special alert system for national emergencies. Now, college attendees are already able to earn credits for their degree in the medical and psychology fields. The U.H.C. includes those practicing holistic and natural medicine, because those are just as important as any pharmaceutical that we have. Those students assigned to service roles will receive college credits for their degrees. Now, peer counseling is essential as well, or peer support services. These will be implemented in schools, hospitals, rehabilitation centers, and for emergency personnel. Everybody needs a little counseling, and we can't disclude those who have to deal with the trauma that we go through as well. It's important to utilize every resource we can for a healthier nation. Education classes related to health will include integrating healthy habits through home economics, physical education, mental health education, and these will be required courses for graduation through the national education system. Naturopathic integration will be let's rephrase that. The introductory course for natural and holistic medication or services would be a required elective for a medical PhD. under the U.H.C. Abortion education strategies are included in this. Education system should teach the medical side of the issue, while parents and religious communities address the spiritual side of the issue and the personal aspects. This is how it should be with the current health system and education system anyway. It takes a village to do a lot, so including everyone, to do a lot of things. How are we supposed to make our great village thrive if we do not properly educate our young, trying to say youth, future generations, essentially? The U.H.C. works with the national education system to teach our youth healthier habits all around. Now, as far as the U.H.C., that's all I have for today. We're going to continue with that next week. And then we'll be continuing with the rest of the National Wildfire Resilience and Forest Ecosystem Management Initiative and how it relates to our healthcare. That is all I have for today. Thank you for your time, and may our path lead to peace and prosperity.